So these two vertebrae are special. This one is known as C1, cervical vertebrae 1, or is commonly called the atlas. This one is C2, cervical vertebrae 2, and is also called the axis. Now these articulate with the skull or with C1 and create unique head movements. So C1, or the atlas, is special. Like all cervical vertebrae, it has our transverse foramen, but if you notice, it has no body associated with it. The superior articular processes are also very large, and these articulate or touch the occipital condyles of the occipital bone. So again, this lines up with the foramen magnum. C2, or the axis, does have a body, but it has been modified with this superiorly pointing process called the dens. Some textbooks call it the odontoid process because it kind of looks like a tooth. So this articulates with the atlas to allow us to rotate our head. So, articulating with the occipital condyles of the skull, the atlas and occipital bone articulation allows us to say yes to things, and the articulation between the atlas and the axis allows us to say no. And again, this is a special type of joint, and if you notice, we're creating a pivoting motion. So the atlanto-axial joint, so between these two vertebrae, atlanto-axial joint is considered a pivot joint.